Welcome everyone to today's lecture, which is Heading in Soccer for the National Fellows lecture series. We are very privileged to have three experts in the field sharing with us today. As a reminder, this is recorded. If you have any questions that come up or you'd like to ask anything, please just shoot it into the chat and we'll be able to have time at the end to address it. And also make sure that you stay on for the whole time because everybody's going to be available to answer all of your questions. We're going to start with Dr. Hamish Kerr. He's the head team physician for Siena College and is a sports medicine fellowship director for the Albany Medical Center and a professor of medicine and pediatrics at Albany Medical College. He serves USA Rugby as chair of the medical risk committee and is a team physician for the USA Eagles men's national team. His training includes undergraduate physiology and sports science and medical school at the University of Glasgow in Scotland. He completed internal medicine and pediatrics residency at Albany Medical Center and a primary care sports medicine fellowship at Children's Hospital Boston and Harvard Medical School. He has lectured and published articles on the biomechanics of heading in soccer, rugby tackling, and concussion prevention. His recent focus has been on cervical muscle strengthening. We will also have the pleasure of Dr. Jeff Mjaanes. He's the head team physician and director of sports medicine at Northwestern University. He is a member and on the board of directors of the National Operating Committee on Standards for Athletic Equipment, a team physician of US Rugby, a licensed medical trainer for World Rugby, and a former head team physician of the Chicago Fire and former team physician of US Soccer. And lastly, just because we love all-stars, we have Dr. Margot Putukian, who serves as a consultant with Major League Soccer and is their chief medical officer. She is the former director of athletic medicine and head team physician at Princeton University and is board certified in internal medicine and sports medicine. Dr. Putukian is a past president of the AMSSM and has served as a team physician for the U.S. men's national lacrosse team, currently serves as team physician for the U20 U.S. women's national soccer team, and has been a co-author on several team physician consensus statements, such as the AMSSM position statement on concussion and mental health and the IOC mental health in elite athletes statement. She is a member of the Concussion in Sport Group Scientific Committee, serves on the National Football League's Head, Neck, and Spine Committee, the FA Research Task Force, the IOC Mental Health Work Group, and the USOPC Mental Health Task Force. That was a bit of a tongue twister because there were just so many accomplishments. But on that note, Dr. Putukian, would you mind taking over and leading us off and kind of telling us how tonight's going to work?
I would be happy to. Thank you so much. And I'm really pleased to have everybody on and to really have the two rock stars are Hamish and Jeff that are going to sort of do a pro con. So Hamish, you want to share our slides? We'll start going. I'm going to be moderating, and we're really going to have a pro con, and then I'll moderate the discussion at the end. We can go to the next slide. Perfect. So again, our goals really today are to talk about and review heading, review purposeful heading, and is it safe? You want to go back one more? There you go. What are the concerns about purposeful heading and what literature exists in that regard? And then really talk a little bit, about sort of the quality of the research as well as the literature. And then these guys are going to have a debate, and we'll go from there. Next slide. So the disclosures are listed here for both Dr. Kerr and Dr. Mjaanes, and these are my disclosures here as well. Next slide. So why this talk? In 2016, US Soccer actually put in place some heading rules for youth players, and recently in 2020, the English FA, along with the Scottish FA and the Irish FA, published guidelines which similarly limited heading in their youth. The links are here, and I think they're actually very interesting when you read through them. The impetus for both of these releases was really the publication of a study from Scotland that looked at former professional players and noted an increase in terms of dementia compared to age-matched controls, the field study. And so there were concerns related to this particular study, and based on what the US had actually already done, these groups decided to implement their own limits in terms of heading in youth players. So again, I think it's timely. It's the end of soccer season in the US, and we thought it would be a good topic to sort of reintroduce to you as fellows related to the topic of heading. Next slide. So as everyone probably knows, I think one of the take-home messages is there's a difference between sort of the behavior of heading, which is sort of an aerial challenge, versus purposeful heading, right? Where you're actually using your head to advance the ball. And there are certainly different types of heading. One, you could be controlling it, you could be passing it to a teammate, you could be clearing it away, or deflecting it either away from your own goal or trying to score, right? So those are all the different types of headers that really are out there. And they're very different than sort of what occurs in the behavior of heading, which is just an aerial challenge. There have been several studies that show that there are different styles of play, and that males tend to head the ball more than females. Next slide. And when you look at, yeah, go ahead and.
So this is where I was going to take over, Margot.
Oh, okay, perfect. Good.
So thank you. So I'm going to show you a quick video just so that we're all on the same page of what is purposeful heading, and and we'll go from there. So you've got to bear with me a second. This is a clip from the 1980s, and we're gonna go back to when I was 14 years old and watching this game on TV, and we'll see what happens. So that is purposeful heading. And what I want you to look at in the replay is the size of this guy's neck as he heads the ball. So we're going to move on. So my job this evening is to talk about why heading is not a good idea. And I thought I would start by just bringing you back to the 14-year-old me who was playing soccer back in Scotland as a centre back. And whenever the ball was in the air and my team were defending, if I wasn't the one heading the ball, I would get screamed at by my coach to clear the ball with my head. So we're going to kind of circle back to that, whether or not that was a good idea or not. And my job is to perhaps convince you that it was not a good idea, although we have almost 30 years of research since then to look over. So if we're going back to the last century and talking about the 1980s and the 1990s, the literature really starts back then. In Scandinavia in the 1970s even, there were retrospective studies done. The retrospective studies were really of professional soccer players in Norway. We've got a few pictures here of more recent Norwegian players. You can see the picture here of the report that was published in 1981 in the British Journal of Sports Medicine. It was, essentially suggesting that purposeful heading may cause permanent cognitive dysfunction. However, in the years that followed that, it got criticised quite openly for not accounting for confounders They really didn't look at anything beyond purposeful heading, and things like the amount of concussions that these players had, or other aspects of their lives were not considered. So the research was one of the early studies, but really not taken too seriously. If we then kind of skip forward to more recent times, we have a CNN Health release in 2011 by Sanjay Gupta, who really was very concerned about heading in soccer. And in the interim between those two points in time, there was a number of studies published looking at soccer heading, and really, it looked like it was safer than was originally considered by the studies from Norway. So I'm not going to focus too much on that. But the reason that Dr. Gupta was concerned was some of the research that was coming out in the last 10 or 15 years. This had gotten my attention while I was in residency. It was a subject that I became interested in while I was an intern. And then in fellowship, I kind of continued that interest and continued reviewing all this literature. And it was intriguing to me as someone that had played soccer my whole life, and was now in a position to give advice about heading in soccer to my patients. So if we start to look at some of the research that came out in the last 10 to 15 years, it's often to do with brain imaging. This is an example. Michael Lipton's group published a study in amateur soccer players. I want to bring your attention to the fact that there was 37 amateur soccer players. There were women as well as men included in this study, and they really looked at the amount of headers that they did during a 12-month period, and then compared that to diffusion tensor imaging of their brains. I'm not expecting everyone to read through this, but obviously, since this is recorded, you can do so at a later point in time. But the study basically looked at whether or not there were differences between a group of people heading soccer balls around 1,320 times per year and a group of players that were not doing that, and seemed to be able to find that there was a difference in the signal in their white matter in DTI on that basis. So that's the take-home points from this work, was that there was findings that they felt were similar to traumatic brain injury when they looked at players that were heading with a frequency of over 1,000 times per year, which is quite a lot of headers, to be honest. And, particularly if you consider that these were amateur players, not professional players. So why on earth amateur players are heading the ball 1,000 times a year, I'm not quite sure. The studies basically showed similar changes to what we're seeing here, that there were findings on DTI that were really of unclear significance, but were certainly more apparent in the players that were heading the ball over 1,000 times per year. Another study had sort of similar concerns. This is actually from Scotland, and includes one of the authors that we'll talk about again, Willie Stewart, who trained where I did in Glasgow and is a neuropathologist. Again, looking at amateur soccer players, there was only 19 in this study, and they found that there was an increase in corticomotor inhibition when they looked at electrophysiological changes after heading. The changes did seem to be quite transient. They were not long-lasting changes, but nonetheless, there were some changes noted when people headed the ball when they did these investigations. We can look here at what those changes looked like. You do have to appreciate that this required log transformation to really show a difference. So the scale on the left is delta in log errors, which sounds like they had to manipulate the data quite a bit to really show this graphic. But there were changes that seemed to resolve, and by a couple of weeks later were not apparent. Again, the group that Michael Lipton and colleagues have worked with had shown that there were some differences between heading in men and heading in women, and that there may be some differences that women might exhibit more widespread evidence of microstructural white matter alteration than men do. And again, preliminary support for the fact that there might be some consequences of heading the ball. This actually was a bigger study. There was 290 people included in it. There were 78 female soccer players and 212 male soccer players, and they did try and control for other exposures. So it was a little better methodology in terms of conclusions than the previous studies that were mentioned. However, the authors themselves did remark that they felt that their results were potentially spurious. There were lots of possible errors, and the way that the 3D brain imaging was interpreted was open to different interpretations. So they did acknowledge that there were some concerns about possible spurious results. There have been other studies of female athletes. We can see a list of authors here, including Greg Meyer as the lead, looking at whether there may be an effect of from subconcussive head impacts and a potential protective effect of jugular vein compression. You may have seen some of the apparatus depicted here in figure 2, where it compresses your jugular vein, and that's thought to have a protective effect on the brain. So the overall kind of conclusions that have been expressed amongst different people in soccer are that there may be some concern, but there's also potentially scientific studies conducted and people benefiting from marketing the results. This was something that was expressed in a journal that is Science and Medicine and Football in this circumstance, obviously referring to soccer. So there has been some concern that the results and the findings that I've been sharing with you may be overstating the mark to some extent, and that we really don't know what the clinical implications are and the external validity of the findings. However, there's been opinions expressed, and Bennett Omalu, who was the pathologist that really kind of evolved the chronic traumatic encephalopathy debate in American football, came out in 2018 and said that he didn't think that children under the age of 18 should be heading soccer balls. So, there is this persisting concern amongst some in the scientific community that heading might be dangerous. In Italy, they did a study of professional soccer players, and they noted that the risk of ALS seemed to be higher amongst a cohort of professional soccer players. That was a concerning finding. They looked at 24,000 Italian soccer professionals between 1960 and 1997, and 8 of them ended up dying of ALS. So, I mean, that's obviously a concern, but it was a tenfold increase in the number expected in the general population during that year. So you can see here again the piece that was published by these authors, really concerned about the sinister side of Italian soccer. So chronic traumatic encephalopathy and ALS have been described as potentially having similar etiologies. It's not clear, but there are some similar findings in the brainstem and the spinal cord, and that are seen in CTE. So there has been a continued concern that retired professional players may be both at risk of ALS potentially and of dementia. In my own country, there's a couple of high-profile players who have had those consequences and have gotten a lot of press. Jeff Astle was a very famous player who died in 2002, suffering from Alzheimer's, having played for 18 years as a professional player. And Frank Koppel was a player in Scotland who died age 65 of dementia and Alzheimer's, and they've both had big family advocacy efforts to try and highlight the concerns from the reasons for their demise, and particularly heading in soccer. So the upshot of these high-profile cases was the Football Association in England taking heading more seriously and funding research, and that's what we heard about at the top of the hour from Dr. Putukian. So that eventually resulted in a study funded by the English amongst the Scottish, and looked at a retrospective cohort of a lot of ex-professional players in Scotland, and they noted that the risk of neurodegenerative disease was higher amongst ex-professional players, and the risk does go up. I wouldn't say substantially, but it does increase. The caveat was that mortality was much lower amongst the ex-professional players for all causes, but there was a risk of increased neurodegenerative disease, and it was 1.7% amongst former soccer players, whereas it was 0.9% amongst the control group who were not professional players. I am going to hand it over to Dr. Mjaanes at this point to continue. And Jeff, if you want me to advance the slides, I can.
That'd be great. Yeah, thanks. I'll I'll tell you. So appreciate that. Thank you, Hamish, and again, thanks for everybody for joining today. So in our binary here of yes or no, I have yes. So I'm going to be advocating here that you should just go ahead and head the ball, because the bottom line is I get my medical advice from Joe Rogan. Very similar to Aaron Rodgers. And so, I think both of us would just say, go ahead and do it. Just head the ball. So I'm going to go through the argument here a little bit for you. So go ahead and advance if you could, please. Sorry, maybe I should say it in Scottish. Oh, sorry. Thanks, Hamish. No, go ahead. Back one. I have a good line for this one. Yeah, so this is some evidence that heading is not bad for you. Now, Dr. Kerr, do you want to explain this slide a little bit?
So we've been talking about the 14-year-old me so far. This is the 14-year-old me playing centre back for my local village, Strathmiglo United, and my brother doing the same thing. And we're both still standing, age 48 and 46. So.
But given the last 20 minutes, I would argue that maybe this slide is in the wrong column. And actually, this is an evidence that heading is bad for you. Next slide, please. All right. So bottom line is I'm gonna divide my arguments here into the biomechanics of heading. So we're gonna go through that briefly. The mechanism of injury in soccer and which heading is a part of, but what those actually look like. And then some of the challenges with interpreting some of the studies that Dr. Kerr went through. So in terms of the biomechanics of heading, it really just comes down to physics. So next slide. The first thing I would say is the ball is meant to deform. There's a reason that we're not heading bowling balls. The soccer ball actually is meant to deform. And if you catch it in camera at the moment of a header, you can actually see the deformation of the ball. Obviously, then this absorbs some of the force, and that force is dissipated. So force does go to the skull and, of course, the brain, but a lot of the force is dissipated through the ball itself. Next slide. In terms of mechanics, I'm sure all of you are soccer fans or footy fans, and you know who these two players are, but we have, actually, I'll let you, well, I can't hear you. So Mohamed Salah and Roberto Firmino, Bobby from Liverpool. But I want you to look at the video for a sec. So when they're heading the ball, they keep their neck somewhat rigid, and they're facing the ball directly, and they're using their whole trunk to essentially move the ball to the opponent. And so in the pictograph that you kind of see on the right, you're creating a longer lever arm in red than you are in the bottom picture than you would be at the top picture. And so again, this is all about force dissipation. And so then less force being transmitted to the brain. All right, next slide, please. So a couple of studies that I just wanted to go through on this. So first of all, again, like Hamish said, this talk is being recorded, and so there's a lot of words on here, but I wanted to just highlight a couple things from these studies. So this is a first study by Shuchenko and others talking about the biomechanics of ball heading and the head response in soccer. And while the study was mostly looking at the ability of a mathematical model that could correlate with human kinetics in terms of heading, the key here is that it seems that increases in neck muscle activation can actually lead to decreases in peak linear accelerations for the center of gravity of the head. And although they showed that angular accelerations increase, these increases were brief. And so the description here is the idea between a fast spring and a slow spring. And actually, if we have time at the end, there's other studies looking at concussion that the idea of the longer the response kind of lasts, actually the more damage may be done to the brain. And so fast spring in this case would be better. So the idea is that pre-tensing the neck muscles and having that head torso alignment, which are actually implications for coaching and technique, actually may decrease that force on the brain. And we saw that in the picture of our two Liverpool friends heading the ball. Next. So the next slide here is from Nonheim, and this was published in 2003. This is also looking at head accelerations, both linear and angular. And what they did was they put accelerometers on 4 adult males. They had them head the ball, and then they looked at this, and the linear and angular accelerations level for any single heading action were well below what the thresholds are thought to be for traumatic brain injury. And so again, the idea here is, yes, you had the ball. Yes, there's a force that is an acceleration that goes along with that, but they're less than the typical levels that would typically cause concussion. And I'll go through that more in a second. Next slide, please. So a study here looking at real-time head acceleration. And so what they did here was they took 24 U14 girls, and they had a total of 47 headers and 20 non-header impacts that they observed. And the header impacts, you can see here, the peak linear acceleration, 4.5 to 62 G's of force, angular acceleration, 440 to 8,000 rads per second squared. And so the majority of non-header impacts, which are about 40% here, were player collisions with other players, which is a thing that I want you to keep in mind because I'm going to talk about that in a second. None of the impacts that they recorded in this study exceeded the linear acceleration tolerance values for concussion, and although some of the angular accelerations did. And there were not a single concussion diagnosed during this study. Next slide. This is out of Purdue University from the School of Biomechanical Engineering. And this article basically summarizes as saying heading is usually safe. It's actually safer when you have a greater effective body mass, which is determined by the player's size, strength, and technique, which may actually, of course, be indicative of the fact that larger, stronger players are more likely to head the ball with less deleterious effects. Interestingly enough, they also noted that lower ball inflation pressure can reduce the risk of head accelerations. And we'll talk about that in a second. So their summary was lower the ball inflation and teach proper techniques, and you'll probably get by transmitting less force to the brain. Next slide. Two studies here that again follow the same idea of, are there other things that we could do to decrease the risk of force to the brain, accelerations in the brain? And so here's one out of the Scandinavian Journal for Medicine and Science and Sport that talked about it's more the velocity of the ball and how it's traveling than the mechanical properties of the ball itself, which may affect injury rates. And then the second one here is that peak impact force during soccer headers is determined by multiple factors, and some of those can include ball size, mass, and velocity, as well as inflation pressure. So reductions in those factors can lead to an almost 20% decrease in the peak impact force on the brain. Next. So a study here from PLOS One, November, just last year, again, out of Purdue University, looking at lowering the inflation pressure of balls and also taking balls when they get wet and subbing them out for dry balls. So trying to have dry balls and trying to have balls with a lower inflation pressure, you can actually reduce the force on the brain. Next slide. And so we're getting into we're kind of leading into the second argument here, which is it's really not the heading of the ball itself that's the problem. And this is something that Dr. Putukian alluded to at the beginning when we were talking about the studies at the beginning of the presentation. Can you go to the next slide? That really the problem here is, well, we do have concussions in soccer that can occur from the act of heading or the behavior of heading. There's very little evidence in the literature that concussions are the result of head to ball contact for purposeful heading. Most concussions tend to occur from collisions with the head and another object. And those other objects could be an opponent or a teammate, head, elbow, shoulder, knee, foot, etc. Could be head to ground, or it could be head to goalpost. Next slide. Although if you want to linger on this so people can look at those gross pictures, we're good on that too. So here's from JAMA Pediatrics 2015. Dawn Comstock and colleagues looked using the high school Rio data, and they found, again, this was retrospective over about a 8-year period, and they looked at both girls and boys, and what they found here was that the rate of concussion per 10,000 injury exposures was 4.5 for girls, 2.78 for boys. Heading was the most common soccer-specific activity for concussions, but it was contact with another player that was the most common mechanism of injury for concussion. Next slide. An article from, really a letter to the editor from Paul McCrory in 2003, talking about, again, the idea of what is the limit of force that we need to get a concussion. And while the jury is, I think personally still out on what the exact threshold is for concussion, a lot of people take somewhere between 60 Gs and 100 Gs of force for linear acceleration, somewhere between 2,000 and 6,000 rads per second squared for angular acceleration. And he is arguing in his point that most of the impacts that you see from heading the ball are far below those thresholds. Next slide. Actually, in the sake of time, we'll just skip this. Thanks. So this is an interesting study that was released last year, looking at why are we talking a lot about heading when heading is actually not that common of an activity in soccer. When you actually think about all of the interactions in a soccer game over 90 minutes, the actual amount of time or the actual number of headers is actually relatively low. So this is a study from the European Soccer Union looking specifically at heading in children's and youth soccer. They looked at 8 European countries and they focused on U10s, U12s, and U16 groups. They did video recordings. They had one match from 480 teams for a total of 4,302 match hours, and a training session from 312 teams totaling about 2,600 training hours. And they looked at the heading frequency and the type of heading that was done, and whether any injuries were reported. And what they found is that the overall incidence of heading in European youth soccer is actually really low. And so you can see here, the numbers here, that the number of headers per match did increase with age. The only exception was U16 females were almost the same as the U12 mixed groups. But overall, younger kids headed the ball much less. Older kids headed the ball much more. 80% of total headers were from single intentional headers. 12% were from duels. 3% were unintentional headers, basically getting hit by the ball when you weren't looking at the ball, and then 5% were other. Only one concussion was recorded, and that was actually from a collision with a goalpost. Dr. Putukian on this call was a member of a study that was done looking at US soccer after they implemented the rules that we talked about at the beginning of the talk, where they did an online concussion survey to find out how those rules were being implemented. And what they also found in their study was that concussion rates overall were quite low, and fewer than 1 in 5 concussions occurred while attempted purposeful heading of the ball. Next slide, please. And what is the exact risk of the neurocognitive effects that were mentioned in some of the studies? I think one of the big problems here is that most of the studies that we've looked at are very small in subject size. And some of the acute neuropsychological changes may not actually reflect clinical changes. So next slide, please. So here's a study by Dr. Putukian, as well as Dr. Echmendia and Dr. Mackin. And in this study, which was published in 2000, so it's been a while, but they noted that soccer players heading the ball does not appear, in soccer players, heading the ball does not appear to lead to acute changes in cognitive function, as evidenced by a brief neuropsychological battery. But they did also note that there are some practice effects with these tests. And I think we've learned a lot more since then about those practice effects, that those are real, and they happen. And so next slide, please. Again, this is from Dr. Putukian, and this was, again, a while ago, 2004. So we can ask her thoughts on this now, but times change. But again, the idea here is there's really no headgear that we can wear in soccer that's going to protect us. Heading overall appears safe, although obviously for certain people with certain pre-existing conditions, especially a prior history of concussion or prior head injuries, that for most people it's relatively safe. But did reinforce the fact that younger children should probably avoid heading. Next slide. And then 2011, this study showed that while early research did show that, did seem to suggest that purposeful heading could contribute to long-term cognitive impact, prospective controlled studies did not support this, and in fact suggested that purposeful heading does not lead to concussion in more mature players. Next slide, please. And I think this might be fine, like towards the end of my slides, but this is a study also from 2011, and again, finding no relationship between soccer heading and performance on impact tests or symptom report. So part of the issue here, though, is what about younger players? And so this is a study that was actually just released this month. And it looked at header biomechanics in youth and collegiate female soccer. And they found that the level of play was significantly associated with linear acceleration, rotational velocity, strain, and then what's called BSM1, which is the area under the strain curve. And that headers performed by collegiate soccer players had significantly greater mean head kinematics and strain than those by youth players. And this was actually statistically significant. So a really interesting study. And I think we're finding more of these studies with larger sample sizes, where we are starting to see that in younger players, there may be actually more deleterious effects than in older players. Next slide, please. So we started off this talk by talking about the U.S. Soccer Concussion Initiative in 2016. And just to refresh everyone's minds on this, there were a couple small caveats, but the big one to take away for this group would be that the elimination of heading for children ages 10 and under, and restricting the amount of heading, especially in practice, for children between the ages of 11 and 13. So they wanted to limit heading in practice to 30 minutes per week, and a single player shouldn't head the ball more than 15 to 20 times in a week. There were some rule changes as well, so that they could modify substitution rules if somebody suffered a concussion, and that if a player in a game deliberately headed the ball, then they would award an indirect free kick to the opposing team at the spot of the offense. I do want to indicate, reiterate to this group, Dr. Kerr and I, although we advocated, hopefully strongly for certain positions, I think the truth of the matter, I certainly don't want to speak for Dr. Kerr, but I think we have a little bit more of a nuanced view of this. I don't think either of us actually is totally against the U.S. soccer rules. I think we both recognize that there's some value in not having kids under the age of 10 head the ball, which I'll get into why in a second. And I think there's probably some value in also limiting the amount of heading in practice, similar to college football, for example, what we're doing now and trying to limit head impacts in practice and camp. Next slide, please. So the rationale behind this were that children, lack the sufficient neck strength to actually be able to head the ball properly. They have a larger head to body ratio, so the kind of that bobblehead effect. Their brains are still developing, so do we really want to subject a developing brain to significant cumulative brain trauma? And then their cognition and cognitive skills are still developing. Next slide, please. But, some of our concerns with this, we gave a similar talk like this a couple of years ago, and our concerns about this at the time, I think, are still true today, which is one of the concerns with the rules were why limit headers in practice, but allow it in games. And I know we're not saying allow it, but there's less control in games than there is in practices. The rate, though, is much higher for concussions in games than it is in training. And we thought that, it's actually important for kids to learn the technique in a controlled practice environment rather than out on the pitch when they're out for a match. Also, there's very little evidence-based peer-reviewed medical literature to support a ban at a certain age. And I think that was part of this as well, which is the ages of 10, 11, and 13 are somewhat arbitrary. We're not arguing necessarily against the rules for U.S. soccer, but more advocating for the need for further studies to really try to delineate what is the proper age to implement rules like this. And then just other concerns where they didn't really talk about enforcement of the rules for practices, et cetera, and then or education. Next slide, please. Do you want to do this one, Hamish? Or do you want me to go? Oh, you're muted.
Sorry. We may want to just let Margot take over and leave 15 minutes to have a Q&A at this point, Jeff. Does that sound fair?
Yeah.
Yeah, that sounds great. I mean, I think you guys have done a great job in terms of sort of presenting some of the information that's out there. And I would welcome people to put questions in the chat. Melody and I are sort of monitoring that, and we'll sort of make sure that we answer any questions that are put there. But I think this is still, it really comes down to a little bit of a dilemma relating to, some of the things that you mentioned, Hamish, in the beginning of your talk, the old data and the issues that were raised related to the old data were always sort of, what about the confounders? What about, like, can we control for concussion? What about alcohol use? What about motor vehicle accidents? And separating out really heading from other things that might cause brain injury. So, I'm reflecting a little bit right after the Berlin statement in 2017 was published. We had in the United States a summit, right, that was co-hosted by Major League Soccer, NWSL, US Soccer, and supposed to be co-sponsored by FIFA, but they didn't. But one of the things that I thought was pretty informative was, you know, we have all this US data related to concussion in the sport of soccer. And, you know, as everybody probably knows, for women in particular, it's one of the highest sports for concussion. And on the men's side, it's pretty high up there as well. But the European experience is very different. And the European experience is that, oh, concussions don't occur in soccer. So, you know, to me, one of the things that I think is concussions have been occurring in the game and may not have been diagnosed, right? You don't even have to go that far back. You look at Euros in the summer where players that are, you know, they're knocked unconscious, but they continue to participate, they continue to play, and they're not diagnosed with concussions. So Hamish, I guess the question that I'll open up to you is sort of, where do you think the role is of these confounders? And do we know for certain that there aren't issues like concussions that are accounting for these changes?
Yeah, I think that's a great point. So, I mean, essentially what we're saying is, are we really accounting for all concussions that people experience when we start attributing changes in people's brains to heading? And I think that the answer is probably no. There have been some studies that have started to look at that. I've seen some data from Canada, for instance, where when they start to take account of the confounders when you're looking at cumulative effects, it really does, you really do start to realize that there have been traumatic events that may be responsible for cumulative damage. And hence the focus really should not be on stopping people heading the ball, but should be on recognizing when people have a concussion and making sure that they recover from that before they play again. So I would agree with you. I think the original research from Scandinavia was debunked because of the failure to do that. But even since then, even though we know that that is a potential confounder, it's still very difficult to do because in the European game up until now, it really hasn't been, there hasn't been enough focus on concussions, and it's only in recent years that the national bodies like the English FA are taking this seriously. And it's really required these ex-professional players that have had dementia and neurodegenerative disease and ALS for speaking out and forcing that to be taken more seriously. At the end of the day, what happens in the UK, for instance, is everyone just assumes that soccer's safe because we've also got rugby, and rugby's a much more higher risk for concussion. So people assume that that soccer is relatively safe. Well, I think the experience in the United States is very important because of Title IX, we've got many more elite female players in this country, and that has perhaps been one of the reasons that we've got a better awareness of concussion in soccer. Because I mean, women's soccer, unfortunately, does seem to have a higher incidence of injury. But all of that needs to be taken into account when we're starting to attribute changes in the brain and blaming heading. I don't think that really stands up to scrutiny unless it's been very carefully accounted for traumatic events and other things like alcohol intake, mental health, ADHD, whatever else it is.
Thanks. Jeff or Melody, do you have anything to add?
Well, I actually wanted to comment on something that Dr. Mjaanes brought up, which I think is super interesting. You were talking about the different variables that go into the forces when the ball is headed, and it makes us wonder, are we counting heading correctly? So we just count it as one, right? No matter what. And when we say you head the ball, how many times you can head it, is there going to be a time when we can count a different type of heading as a different type of force? So it's almost like we can use a more quantitative more than qualitative one.
Yeah, so, yeah, go ahead, Jeff.
No, I was just going to say, actually, you and I, Margot and I were kind of talking about this before everybody kind of got on today. We were the first two on, and so we were just kind of talking back and forth. And I think, part of the confusion here is that it's not really, again, I think hopefully we kind of made this point, but I really am a strong believer that it's not really heading the ball that is necessarily a big problem here. I mean, there may be a problem, right? I think the jury's still out. We don't really have enough data to say one way or another whether heading the ball 1,000 times in a year for 30 years is going to be a problem. I don't think we have that data yet. But I think the bigger concern that I have is the other impacts to the head that occurred during the act of heading, during the behavior of heading. And so the idea that you're going to come up and you're going to hit an opponent's knee or elbow or their head. And even though that's included when we're looking at studies, it's very hard to tease it out as to whether that occurred from heading the ball or whether the actual impact was from an opponent's head. It's still looped under heading and then counted towards a concussion, for example. The other thing is, and I think this is kind of also what you're getting to, which is you can hit the ball in many different ways with your head. And so while hitting it from the forehead is ideal, sometimes the ball will hit you on the parietal aspect or the temporal aspect. And what are those? Do we know that when you're off center like that, you're likely more to have an angular acceleration? And so what does that do to the strain on the brain tissue? So I think you're right. I think we're going to have to dive into this a lot deeper as we continue to do research in this area and really try to tease out what exactly is happening in those 3 seconds or 2 seconds during a header.
Yeah, and I think, I mean, you made the point, Jeff, previously, in terms of other variables like the size of the ball and the pressure of the ball. And I think that those issues are, especially in kids, really underappreciated. I know that when you look at the science related to the forces that the head sees with the different ball size is really significant. And the same thing with pressure. So, for those of the folks in the audience that are coaches or have kids that play soccer, it's really important that kids that should be using a size 3 ball use a size 3 ball. Kids always want to use the size ball that's used by adults all the time, but there's something to be said for using the appropriate ball size. I think the other thing, there a lot of the prospective data, that the research that's been done has really sort of shown the things that Jeff's talking to as it relates to separating out the kinds of headers. And Melody, you alluded to this too. The forces that, we did a study looking at lacrosse and soccer in men and women at Princeton and University of North Carolina. And the forces that you see with soccer, specifically related to a lot of the common heading maneuvers, whether it's clearing a ball or a cross or a chip or a throw in, are much lower than what you see if someone ends up being struck by the ball that's like, a direct shot, they can't get out of the way. And so that's to Jeff's point in terms of purposeful heading versus, the head gets struck by a ball that they can't get out of the way of. So, I mean, I think those are all important pieces to think about. Another question for Hamish and for Jeff as it relates to, the articles, the Lipton articles and the field data. Obviously, one of the concerns has been sort of self-report, like the number of headers that, someone typically. Can you just comment on that as it relates to just from a research or a methodology standpoint?
Yeah, it's not good. Self-report. I mean, how on earth do people count how many headers they did in the last year? And how does that stand up to quality research? I don't know. If you think about in the Lipton study, they used 1,300 headers above and below that that means that you're heading the ball 20 times per week for an entire year. Now, in any typical 90-minute game, most professional players would head the ball between 4 to 6 times. So how on earth are amateur players heading the ball 20 times a week unless they're playing twice a week, plus heading in practice? So that seems like a very high number of headers to me. And yeah, it's self-reported. So I think, you know, I don't really know that stands up to good science. And I was disappointed by that study. I highlighted it because it was one of the more recent articles to come out. But I mean, the other thing with studies like that is you can really make the brain look any way you want if you use all the sophisticated technology that they do. So, I mean, they're taking they took an arbitrary number of headers and they looked at what was different between two groups. I thought it was really not very well done.
Yeah, I would just I would add that type of bias, you know, is important, especially if we're talking about neurocognitive changes over time. So when you're asking somebody when you're looking at somebody who's 80 years old and you're asking about cumulative brain trauma, one of the limiting factors that we always find in those studies is that recall bias, but then also what are the other factors, as we mentioned before, that can contribute to dementia in older age, and how do you know if it directly relates to that trauma that they suffered when they played soccer or football? Sorry, Hamish. And then the last, I know we're almost out of time. So we meet our objectives, did want to make sure that we talked really quickly about some things that people can focus on in terms of how do we make heading safer. I do think that the US soccer rules are a start, but also rule enforcement is really key. So penalizing players that engage in dangerous play, I think, is something that's really important. And I think that needs to start when they're young, not necessarily the punishment part, but actually the reasoning why, you know, explaining to younger players why that's dangerous. We talked about the equipment and making sure that we are using balls that are the proper size, that they're not overly inflated, and that balls that are wet should actually be taken out, because a wet ball significantly increases the mass of the ball. And then the education piece is key. And then the last piece is just the neck strengthening, which we could go on probably for another 30 minutes about neck strengthening and head injuries and concussion and heading. But, you know, suffice to say that core muscles and neck strengthening are important. And they're really, even in a young child, you can do easy isometrics that are not going to cause any harm and actually may cause some benefit. So I would just leave it at that, I guess, given our time.
Yeah, I mean, I think, you know, as a young player, I remember being told to hit the ball. Like when you're heading the ball, don't let the ball hit you, hit the ball. And that speaks to a lot of the things that you mentioned, Jeff, in terms of your talk, right? The neck strength. And, you know, if the neck is rigid, then the mass is not just the head, it's the body, right? So that changes that physics equation. I want to make sure that we answer the question that was put in the chat, the one question by Thomas. And I'm not sure if I understand it completely, but I think it's speaking to whether or not there's technique training, that if, you know, sort of in the US, we don't have a lot of technique training, and that in the rest of the world, they learn playing by playing. I'm not sure if that's exactly the focus of your question, but, you know, and if not, please feel free to unmute and chime in. But, you know,
yeah, it was just more of like, I'm hearing things like, oh, you need to change out like a wet ball during the game, or a kid doesn't have a size 3, like have a size 3 versus a size. Soccer globally, and from what I've seen, it's a very it's like a sport of the people. It's a working class sport, whereas in the U.S. it's largely still, although it's gotten better, a more suburban, affluent one. So my concern with all of the account that many youth players, especially ones that will come to this country from like that are immigrants, they're growing up as youth players with like one ball, And that's what they have. And then many kids also, it could be a way out, as opposed to many of the suburban players where it's just kind of like a kumbaya type, and it's a growth and development. So I do think that there's some inequities that need to be kind of at least acknowledged, that globally, when it comes to soccer, like the US, how it's constructed, it's a little any of the other countries in the world.
Yeah, I mean, I'll just say that, you know, having been on the U.S. Soccer's advisory committee when they came up with this, I was actually a little bit I wasn't necessarily a big fan of having a ban on heading, because I thought it sent the wrong message related to heading. Right? Really, the message was that heading is not the problem; it's the aerial challenge, and that was what they were trying to limit when they put the ban on youth. So, I mean, I do think that when you look at the data, there's not much heading that occurs in younger kids. And that's part of the reason why the ban per se, or the limits on heading, haven't made, aren't going to really impact the sport, I don't think, in the way it's played. But to respond to your, I don't know, it's a hard question to answer, right? As it relates to sort of socially how the sport is played and the differences therein.
Margot, I would jump onto that comment and just say, I think the reason that this is a difficult question to answer is that the US has effectively stopped younger players from playing, and in other countries around the world, you know, from the age of 4, 5, 6 years old, they're just playing and they're just learning the game. Right. And we're basically stopping them from doing that. Now, you know, I wasn't any part of the US soccer decision. I did try and influence the Scottish Football Association from making the same decision, but unfortunately I wasn't successful. So they've also banned heading, and it is what it is. I mean, I'm just going to focus on something else, but the fact I've coached from kindergarten up till, you know, U18, and younger players don't want to head the ball.
Exactly.
They're not interested in it. That doesn't look or sound fun to them. When they get to 10, 11, 12, they start getting interested in it, and it's probably because their neck's strong enough to do so. All my focus now has been on testing neck strength in soccer players, and we're hopefully going to have some better data on that in the next couple of years. But you know, to Thomas's point, I think it's a good point. In the rest of the world, they're learning to play, and they're getting the opportunity to do things without coaches or parents or anyone telling them what to do. And unfortunately, in this country, that is not the case. There's much less free play. I played soccer 3 hours a night every night for 10 years when I was in elementary, middle school, and child, and that just doesn't happen anymore.
Yeah, that actually makes a lot of sense now, Hamish. Oh, I wasn't muted. I thought I was muted. I'm so sorry. The only other thing that I would say too, I think Thomas's point was actually a great one as well, because I think even in a field in El Salvador or in Brazil, you're still going to have an older player that still teaches those younger players how to head properly. And I think that's exactly one of the things that we need to, focus on. It is true. The ball size and removing wet balls and coming to the field with 50 balls, like that's an American phenomenon, and maybe a European phenomenon, but that's not the way soccer is played in 90% of the world. And I just activated my Alexa Nest or something. Sorry about that in the background. I don't know what I said, but the bottom line is technique, I think, is the key, and making sure that they're approaching it the right way, just like we saw in the video with Salah and Bobby. I think the bottom line is you got to head it with proper technique.
Yeah, and the technique part and the education related to that, is certainly not something that, U.S. soccer would sort of, they want to support proper technique training, because they understand that is a piece of the game that's really important. So, well, I think to sum up, I guess, Melody, you want me to try to summarize a little bit here. I just want to thank Jeff, Dr. Mjaanes, and Kerr for a really good, thoughtful, evidence-based presentation tonight. You know, the pros and cons of heading in the sport of soccer, and hopefully everyone's taken away some good information, some good questions, and I'm going to speak for all of us in saying that we're, including Melody, that we're all very, very willing to sort of respond back if there's any questions that persist, and hope this has been helpful to all of you, and thank you for your time. And then also to make sure that you know that they're 7 minutes into a research presentation for AMSSM that's ongoing.
Yes, and next week we have our Fellows Online Education Series continuing. The topic is anaphylaxis and severe asthma exacerbation. So another riveting topic that will inspire a lot of debate. Okay, thank you both. Thank you all, and we'll see you next week.
Thanks, guys.
Thank you.